Good afternoon, everyone, and thank you for joining us here today. And I want to thank my colleague, Cliff Cullen, Minister of Education, as well as Dr. Jas Atwal, Deputy Chief of Provincial Public Health Officer, for joining me here today for an important update on Manitoba's return to school plan. First off, I want to wish all Manitobans a happy and healthy New Year. While the last 20 months have been a challenging time, I'm confident that we will get through this together, and brighter, happier, and healthier days are ahead of us. I want to thank Manitobans who altered or canceled their plans over the holiday season to help limit the spread of this virus and protect themselves, their loved ones, and their community. As we continue to deal with the challenges of COVID-19 and learn more about the impacts of the Omicron variant, I want to thank the healthcare workers across our province who have worked tirelessly to provide quality care throughout this pandemic. Thank you for your dedication and commitment to your patients and their families, especially during these difficult times. Our government's #1 priority is to protect the health and well-being of all Manitobans, especially our most vulnerable. And this is what brings us here today. As a mother of 2, nothing matters more than the health and safety and education of my children. As parents, we want to give our children every opportunity to learn, create, play, chase their dreams safely. As previously announced, students were set to return to the classroom on January 10th, following an extended winter break. Today, we are announcing a 1-week remote learning period beyond January 10th to help ensure schools can implement enhanced measures for the safe return of in-person learning. We know that our youth learn best in a classroom setting. It is our goal to ensure they can return to the classroom as quickly as possible. With that, I'll pass it over to Minister Cullen to provide further details on the announcement today.
Thank you very much, Premier. Cliff Cullen, Minister of Education. Good afternoon, everyone, and Happy New Year. I do want to begin by thanking all teachers, school staff, school leaders, school divisions, parents, and caregivers for their dedication to the students of Manitoba. I also want to acknowledge 2 losses over the winter break at J.B. Mitchell School. Teacher Megan Wolf and Principal Paulette Huggins. Their deaths are a tragic loss to our community, and I send my condolences to their family and friends, and the students and their colleagues. On December 22nd, our government made the announcement to extend winter break until January 10th. Today, we are announcing a phased-in approach for return to school in January and are shifting to a 1-week remote learning period for most students after the holiday break. This phased-in approach will allow school divisions and schools to have more time to prepare operational plans, including planning for potential staffing shortages and expected absenteeism due to isolation requirements. Discussions with Manitoba Education's response planning team have reinforced the importance of this extra time to plan for a return to class as soon as possible. This planning team has been in place since March of 2020, and it includes the Manitoba Association of School Superintendents, the Manitoba School Board Association, the Manitoba Association of School Board Officials, the Manitoba Teachers Society, Manitoba Federation of Independent Schools, and public health officials. This will ensure public health officials have more time to assess the effects of the Omicron variant. Effective January 10th, this phased-in approach will allow students of critical service workers in kindergarten to grade 6 and at-risk students and students with special learning needs in kindergarten to grade 12 to attend school. Before and after childcare programs will remain open for students of critical service workers and students with special needs who are attending school this week. All other students will learn remotely until they return on January 17th. This extra week of remote learning will provide time for distribution of additional masks and rapid tests to schools across the province. Access to rapid tests for all Manitobans will be expanded as the rapid testing kit supply increases here in Manitoba, particularly for schools with high case counts of the COVID-19. We will also be distributing more than 5 million additional child and adult medical masks over the next 8 weeks to increase existing supply in schools. This time will also provide teachers and those over 18 who are eligible to get their booster shots and students 5 and up to get their second dose. To improve accessibility and increase immunization rates, after-hours school-based clinics will continue for students, for staff, and community members. Our government recognizes there are financial pressures related to wage agreements for teachers, as well as the ongoing impact of COVID-19. Today, we're also announcing an investment of up to $80 million in new funding for Manitoba schools for the 21-22 year. Today's investment will ensure our school system is supported, particularly during COVID. Manitoba has exceptional teachers, school staff, and leaders committed to ensuring students reach their full potential. Our investment will enable schools to continue providing high-quality learning for all Manitoba students. With today's funding announcement, our government has invested an additional $200 million for school operations this year alone. This includes $45 million for a 2% property tax offset grant paid directly to school divisions. We've also increased the operating budget for schools. This year, to date, we have invested $63 million to support the COVID response. I will say that Manitoba has one of the highest per pupil COVID funding allocation in Canada. To date, over $330 per pupil. Almost half of this allocation is going directly into the classroom to support additional teachers and educational assistants. The remainder is being used to fund health and safety measures, ventilation upgrades, remote learning, masks, and personal protective equipment. The school division's plan for the next school year, I want to assure them and you that our government is considering future impacts of the pandemic along with other financial pressures as we go forward. Again, I say to all teachers, school staff, school leaders, school divisions, parents, and caregivers, thank you. This phased-in approach will ensure that in-person learning will continue in the longer term for all students. I want to encourage all those that are eligible to get their next vaccination to please do so. This is so critical for our way and our path forward out of this pandemic. And I'll pack it back to the Premier.
Thank you, Minister Cullen. I also want to commend our teachers, administrators, education, support staff for all they do to keep our children safe. COVID-19 has challenged us in so many ways, and I thank you for your willingness to adapt and find creative and innovative ways to keep our children engaged and able to reach their full potential. We also want our children to be able to attend school in person and participate in their normal extracurricular and social activities and achieve high vaccination rates in both adults and children, achieving high vaccination rates in both adults and children will be key to ensuring that can continue to happen. I would now like to invite Dr. Jas Atwal to provide an update from Public Health. Jas?
Good afternoon. Thank you, Premier. Thank you, Mr. Cullen. My name is Dr. Jas Atwal. I'm the Deputy Chief Provincial Public Health Officer for Manitoba. We are continuing to see increased COVID-19 daily case numbers and test positivity rates. As we announced earlier this week, we have been deploying rapid antigen tests at several COVID-19 testing sites over the last several days and will continue to do so to increase our testing capacity. Since last Friday, we have reported more than 7,100 positive cases of COVID-19 in Manitoba. These counts are not unexpected. That's why we put a number of public health orders in place to help reduce the spread of the virus. It's why we continue to ask Manitobans to reduce their close contacts. And it's why we're moving forward with today's announcement. We know in-person learning is best for students, but we are still learning about how the Omicron variant will affect our healthcare system and Manitobans in the long term. Given that so much is still unknown about the Omicron variant, we are moving quickly on the return to school option to give parents the time they need to make plans for remote learning next week. This change will allow us more time to study the data we have and provide any needed additional advice to the education sector. Remember, there are things we can all do to help reduce the spread of the virus. Focus on the fundamentals to limit the spread of COVID-19. Limit your contact with others and only get together with immediate family. Stay home when you are sick. Go for testing and isolate until you get your test results. Wear a well-fitting mask, wash your hands frequently, and cover your cough. Thousands of Manitobans have been vaccinated and continue to follow public health orders. We thank you for that. Protect yourself and those around you by getting fully vaccinated or going for your third dose as soon as you are eligible. Thank you, and I will return things back over to the Premier.
Thank you, Dr. Atwal, and thank you to you and Dr. Roussin and your team for your dedication to keeping Manitobans informed, especially as we learn more about the Omicron variant and its impacts on our communities and our healthcare system. Vaccines work, and now more than ever with the Omicron variant circulating throughout Manitoba, it is crucial that all Manitobans get fully vaccinated, including a third dose when eligible. Follow the fundamentals. Stay home when you're sick, get tested, wear a mask, socially distance, and limit your close contacts. We can and will get through this together. Thank you, and we're now prepared to take any questions that you may have.
Why is the decision to just extend it by 1 week? Given what we're seeing with Omicron and the increase in hospitalization numbers, why is the decision being made to sort of go at it week by week instead of giving parents and teachers more certainty?
So really the reason, and I'll let Minister Cullen answer and elaborate on this, is that stakeholders within the education system have asked for this to adequately prepare for students to go back into the classroom setting. So there's obviously some changes that have taken place there. They need the time to get ready for this. And so I'm not sure, Minister Cullen, if there's anything you want to add to that.
Thanks, Premier. Exactly it. I mean, we've been working with our stakeholders in education since the onset of COVID-19 back in March, working with them day in and day out and with public health. And they came to us the past week and said, listen, we need some more time here. And we want to get this right, and it's about protecting our students, and it's about making sure our staff are safe. So obviously we're learning about Omicron as we're going forward. We just want to make sure that we have all the necessary protocols in place to make sure that the return to school on the 17th is safe for all.
And Dr. Atwal, if I may, why is Manitoba not in code red? Looking at our pandemic response system, we seem to qualify for code red given the demands on the healthcare system and the widespread community transmission. So why are we not in code red?
Rapidly evolving situation. We're looking at risk right across in other jurisdictions as well. And we've made a lot of changes here on the public health side as well. So, we pivoted case and contact management. We rapidly changed our testing strategy, and we'll continue to look at that. And we're going to continue to look at the evidence. And again, when further information is available, when announcements are ready to be made, we will make those announcements as well.
Expect the situation to improve in 1 week's time so that kids might be in school on the 17th? Is it, given what we're seeing with this virus, is there any reason to believe the situation might be better a week from now than it is today?
So again, things are rapidly evolving. I think we have to continue to look at what the evidence is showing. And again, we are working behind the scenes quite diligently here to make sure that Manitobans are protected. And there is a balance here. We have to look at risk, and we have to also look at what the implications of orders are and restrictions are as well. So again, once we're going to continue to evaluate the evidence, and when an announcement is available to be made, that announcement will be made.
I guess for either the Premier or the Education Minister, do you think of 1 week is enough?
So first of all, I'll just start and let Minister Cullen, again, just a reminder that this is about the education stakeholders asking for an extension to put the appropriate measures in place to ensure the further safety for kids and in-class learning. So that's what this is about today, rather than it being about sort of what you're alluding to. Of course, Dr. Atwal has answered that question already, but I don't know, Minister Cullen, if you have anything that you want to add to that.
Yeah, I think you're right again, Minister. They came to us looking for more time. And again, this is a safety issue, and we want to make sure that we have protocols in place. We'll be taking advice on potentially additional protocols from public health to make sure that we do have safe environments in school. And that's really what this is about.
Dr. Atwal, we're talking about safety for children. Is there a potential risk for the Omicron variant to potentially harm children?
Noise on my speaker here, and I am having a tough time hearing your question.
Thanks, Dr. Atwal. Just wondering, is the Omicron variant potentially harmful to children, and what's the evidence on that?
So the evidence is still evolving on that. We do know that Omicron has less severe outcomes in general than Delta, especially in those who are vaccinated. We're still trying to tease out those who are unvaccinated with Omicron and understand what the risk there is, and those who are vaccinated separately and what that risk is as well. And the evidence still has to come in. But in general, an overarching review of this, it does show that Omicron is less severe. In Manitoba at the present time, there really doesn't seem to be anyone in hospital that is any children who are in hospital related to Omicron at the present time as well. We also have to understand how important education is from a determinant of health perspective. It's an important determinant of health, and learning and having that education, having those interactions are very, very important in development. And we've disrupted that for the past 2 years' time. So our goal, and we've always said this, education is very important from a public health perspective. We're doing what we can to mitigate COVID-19 issues within school settings. We're going to continue to work on that and strive for that and get those kids back into the classroom. And this measure here is just an interim step here, a phased-in approach to make sure that we can mitigate as much as possible the impacts of COVID-19 following the holidays to ensure that kids are able to partake in that important activity of being at school.
You've always said that schools are the first to open, last to close, but retail stores are still open, restaurants are still open. Can you talk a bit about the decision here?
Well, again, we're not talking about closing schools. What we're talking about is just extending the period of time to allow for the appropriate preparation to take place to ensure, further safety based on this variant within the classroom setting. And so that's what we're here to announce today.
What exactly are we talking about with these new medical masks? Are these the blue masks, disposable, KN bags?
Yeah, I'll just comment on that. I mean, we've been supplying call them medical mask or procedural mask, as you're wearing, to the school system for quite some time. And I think there's some confusion out there in terms of what the different level of protection masks may afford. And I think maybe be a good time to turn it over to Dr. Atwal, being the expert in this field, and maybe clear the air on what these masks are all about and maybe some of the expectations that are out there and maybe some of the misconceptions around masks.
Thank you for that. Yeah, so, from a mask perspective, I think what's really important on the mask side is we have a good seal on a mask. And in younger kids, smaller faces, we want a good fit for that mask as well. So there isn't a universal fit for everyone, and depending on their face, depending on facial hair, etc., you could have different types of seals and fits related to that. I know there's been a lot of talk about N95 masks. I mean, those are used in medical settings where there's aerosol generating medical procedures occurring. A good mask that is a 3-layer mask provides good protection. The important thing there is putting on that mask properly, taking off the mask properly, and making sure there's a nice tight seal there. You could have the best mask available, but if you don't use it properly, if you're not washing your hands regularly, if you're not making sure that there's a nice seal there, the use of that mask actually likely increases one's risk of getting COVID-19, not decreases it. So you want to make sure that, on the masking side, a mask is important. We want everyone to wear a mask. A good mask, a 3-layer mask is important to use. That'll provide good protection as well. And having that nice seal is what we should be looking at, and making sure that the fit is right, especially young kids, is important as well. So that's comfortable for them, so that they're wearing it, they're not always touching it and moving around. That's very important when we're talking about masks. So let's think about seals, a nice tight seal on a mask, and the fundamentals in wearing a mask as well. That'll go much further in mitigating issues related to COVID-19 than any specific type of mask that one wants to talk about.
Dr. Atwell, does that mean that fabric masks, non-medical masks will still be used in schools, or is now everyone required to wear these 3-layer blue medical disposable masks?
Sorry, my speaker isn't working and it's just hard to hear. Can you just repeat that, please?
Yep. Dr. Atwell, does that mean, are there going to be any changes to the actual mask protocols and requirements in schools? Or will non-medical fabric masks still be all right? And yes.
So on the student side, again, we're looking at what the students are comfortable wearing and making sure that there is a nice seal there. Again, we're going to continue to look at the evidence, and as evidence evolves or new information comes in, we might change our recommendation in the future, but at the present time, we have a recommendation. We're going to continue with that recommendation on the mask side.
Childcare workers are allowed to go back to work with mild symptoms if they're vaccinated. Will that be the same for teachers as well?
So healthcare, I'm going to apologize again. I think we're having some technical difficulties here, but from a standpoint in relation to case and contact management, we have changed our case and contact management so that if one is a case and they're fully vaccinated, as long as 5 days go by, they are able to, return to their workplace and return to society per se, as long as their symptoms are resolving and they have minimal symptoms and they're resolving and they're afebrile for at least 24 hours and they're fully vaccinated, and they have to wear a medical mask for another 5 days afterwards. And we're looking to see what recommendations we'll make on the education side as well, and those are still being finalized.
Will this extra week allow for rapid tests for every student in K to 6? So they'll have them in hand by the time they come back to school on the 17th?
Yeah, we've sent out 550,000 tests to the students for K to 6. We expect that they will be in their hands still for when they come back to school. This extra week will allow us to get our hands on more of those tests and get them out to schools, particularly those schools that may be facing high numbers or outbreaks. So we want to have making sure we have a targeted approach and making sure we're getting the best value for these rapid tests.
Dr. Atwell, there's some technology issues here, but is there a reason you can't be with us today in person answering the questions?
I think it's just sort of the format and having the ability to socially distance within that room.
How does this have any impact on school-based sporting activities or youth sporting activities?
So on the sporting side, my understanding is that is still being reviewed and being looked at in relation to what will happen for that week.
Yeah, Dr. Atwell, how many healthcare workers are off sick right now in the province?
Can you just repeat that question, please?
How many healthcare workers are off sick right now in Manitoba?
I don't have that number. Perhaps our communication side might be able to provide that to you after the meeting here.
We'll jump to participants joining via Zoom, and then we'll come back to the room before we wrap it up.
Thank you. A reminder to our reporters on the line, you will have one preliminary and one follow-up question. Up first this afternoon from the Brandon Sun, Kyle.
Good afternoon. I don't know who this question is for specifically, but I want to go back to something that Mr. Atwal said. He said that this spike in COVID cases was not unexpected. So I'm wondering, if this wasn't unexpected, why is this move being made right now? Back in December, Dr. Rousseau was predicting 1,000 cases a day by this point in the new year. So I'm wondering why the province didn't take proactive measures like they did in December of 2020 and announce a move to remote learning early that month instead of in the new year.
So when we were looking at cases back in December, I mean, there was a model there, and models, we've had lots of different models showing lots of different things, and sometimes they're accurate, sometimes they're not. We knew that cases would increase, just from the inherent nature of this virus. It is much more infectious. So we knew we'd be generating a lot more cases. And the evidence was still rapidly evolving at that time. It's always easy to go back, and hindsight's always 2020. We were rapidly changing a lot of the things that we're doing in public health during that time as well, and in different sectors. We knew schools would be off for a period of time as well. And from a planning perspective, we wanted to see what the impacts of cases were early in the new year, and perhaps have more information available from other jurisdictions on the impacts of severe outcomes as well. And that information is still coming in. We were hoping we'd have a lot more information even by now, even by last week actually, but it looks like it'll take another week to really tease out some of that important information we need in relation to severe outcomes and Omicron and its impacts on risk of hospitalization and ICU use.
All right, thank you. Just as a follow-up too, I was just wondering, there are some people who believe that this announcement is just kind of part of a reoccurring pattern for the province, where you guys are being more reactive than proactive in terms of your reaction to the pandemic. So I was wondering what you would say to critics of that nature.
So maybe I'll start with that if I could, and then maybe pass it on to Dr. Atwal to talk about, more around the public health orders, and the reasoning for them at any given time. I would say that we were more proactive when it comes to certainly this variant. We knew that from other jurisdictions. That's why we actually put in place further restrictions than most other provinces across the country at an earlier time. We also didn't open up to the same extent that many other provinces did. We kept many of those restrictions in place, and so we have taken a proactive approach to this. And but certainly, Dr. Atwal, if you want to make a comment on that too.
Sure. I mean, it's challenging. When you're looking at COVID-19, the entire pandemic that we've gone through, how the virus has shifted, and it keeps shifting, and it makes it difficult to predict the future. I think we have been proactive, and I think we've done what we needed to do with the resources we have and the abilities that we have to help mitigate issues as well, and to make sure that we have a functional system, a functional healthcare system, a functional public health system as well. So it is challenging all around. I think we've done a lot of measures here. We knew Omicron was coming, and we did make a large shift in relation on the public health side related to case and contact management. We shifted testing. We shifted it more than once because of the issues related to testing and the demand on that testing. We've incorporated a lot of other types of testing tools as well to help, again, try to mitigate that issue and to try to see what is the best path forward in relation to managing Omicron as well. I know the acute care system has always tried to been proactive to try to increase their capacity to be able to manage cases related to Omicron as well, and to COVID-19, whether it's Delta or Omicron as well going forward. So it's just challenging all around. And again, we don't have crystal balls. We're doing the best that we can with the information and resources we have to, again, try to, keep Manitoba safe, to keep Manitobans safe, and to ensure that we're able to partake in those activities that we enjoy to do. And that is a challenge. When we look at impacts on health, it's not just the acute care system we have to look at. We have to look at all the other impacts on health. There's a number of determinants of health, and education is one of them. That's why we've always prioritized education, and that's why we're doing this phased-in approach to education, try to make sure kids are able to be in school, to help mitigate those issues of COVID-19 in schools, to make sure that there's teachers there to teach as well. I have 3 kids in school. School is very important in my life and will be important in their life, and it should be important in every Manitoban's life, whether you're a parent or a student or a grandparent. So we're going to try to create, as best as we can, a safe environment for that. We're trying to be as proactive as we can be, but there's a lot of things that happen, and there's a lot of things that we have to deal with to mitigate issues and to be able to keep pushing forward our ability to try to keep Manitobans safe and adjust to how the virus is adjusting to our measures as well. So we're going to continue to do that, but it is a challenging situation for sure.
All right, thank you.
From CJOB, Rosanna.
Hi there. The Manitoba Pediatric Society addressed a letter to you, Premier Stephenson and Minister Cullen yesterday, calling for children to go back to school, provided some conditions were met, like providing higher quality masks, improving ventilation, making rapid and PCR tests available to symptomatic staff and students. Were those considered in this decision? And why haven't the province's resources been prioritized to keep children in school before getting to this point?
Go ahead.
Yeah, ever since COVID became a challenge for us in Manitoba, we've taken a proactive approach. The first year we invested $185 million to combat COVID. This year, $63 million to date. A lot of that, again, goes into masks, personal protective equipment, rapid testing kits, enhancing ventilation. We've invested money in remote learning. And most importantly, we've put extra teachers in classrooms because of COVID. And we've also put additional education assistants in classrooms as well. So we've been very proactive ever since the outbreak of COVID. Clearly, we're facing a new variant. And we want to make sure we're taking every precaution necessary against Omicron and protecting our students and our staff as we go forward. That's why the people within the system have asked for this extra week to make sure that we have precautions in place, and that we've got proper protocols in place to keep everyone safe.
Thank you. Premier Stephenson, in the past with remote learning and other restrictions, the period has often been extended beyond the initial announcement. Can you take a moment to speak directly to young kids today and explain why this is happening? Are you sorry it's gotten to this point?
So this is all about, and I'll repeat it again, and I know that Minister Cullen has mentioned this as well, that, this is about ensuring that we take the time and that we give the appropriate time for those individuals to prepare for in-class learning. And so it's really about putting the proper protocols in place and taking the time to do that. So this is to ensure that, and we're very confident that that extra week will allow for that to happen. We obviously, with the Pediatric Society and others, that in-class learning is the best option for our children. And we will continue, but we need to do it in a safe way and allow for the appropriate protocols to be put into place to ensure that safety as well. And so we will continue to work with stakeholders toward that end to ensure that by the 17th, all is in place to return kids to the classroom.
From CBC Radio Canada, Anne Louise.
Hello. Well, the student at the origin of the petition to keep Manitoba students in person told me that many students do not have the material to properly follow online courses. Do you plan something in terms of maybe computer, for example?
Computer equipment?
Yeah, so,
Computers, is that what?
right, yeah, just what's being offered, I think, in
Yeah,
terms of.
sure. So I talked about our $185 million investment last year, $63 million and counting this year. We're allowing individual school boards and schools to make those decisions in terms of where they best see those assets utilized. I know a lot of school divisions and schools have purchased equipment, in-class equipment, whether those be whiteboards or laptops for individual students. We have set aside money for that, and they have allocated that resource. So clearly, again, with the announcement of an additional $80 million going into the system, we expect some of that money will be used for COVID response. And again, we're not dictating how school divisions will use that money.
Well, thank you. That's not really a following question, but you talk about a high number of cases. Could you clarify how many positive cases has been reported since September in school in Manitoba?
So a specific question around the number of cases in schools since September. No, I don't have those details on hand, but we'd be happy to supply those numbers for you.
Thank you.
From CTV Winnipeg, Jeff.
Hello, this question is for Premier Stephenson. Premier, I'm wondering if your government is considering, though, if cases keep going up the way they're going, is there any kind of lockdown being contemplated right now? I guess it is more towards kind of Steve's question of code red, but are you contemplating any kind of lockdown if things get worse, like we've seen in some other provinces?
We continue to obviously work with public health on this issue. Jeff, thanks for the question, and certainly, we want to ensure the safety of Manitobans, and we will continue to do this. As Dr. Atwell and Dr. Roussin have stated, case numbers are on the rise, but case numbers maybe mean something differently with this variant. And there's been preliminary results out there showing that they're maybe not as severe as the previous Delta variant. These are all things that we need to take in consideration. It's all about, what does this mean to our hospitalization numbers? What does this mean to our ICU numbers? And we need to keep laser focused on that. It seems that some people are getting the Omicron variant that are not getting severe outcomes. Some of them don't even have symptoms. So there are things that we need to keep focused on, hospitalization as well as the ICU numbers, and we'll continue to focus on those.
Thank you. I'm wondering what changed between mid-December and late December with former Minister Ron Schuler's position in cabinet. He was at the legislature after the December 15th mandate. He even had a news conference, and then you removed him late December. I'm wondering why and what is his future status in caucus?
So certainly, what I would say is that the public messaging from Mr. Schuler has not been necessarily consistent with the spirit of our government's efforts to get Manitobans fully vaccinated and continue to move forward on that front. And so, I had the discussion, and certainly thank Minister Schuler for his time, but we need to keep laser focused on ensuring that Manitobans get fully vaccinated. We know that helps keep Manitobans out of hospitals, out of ICUs, and we'll continue to promote that as a government.
From CHVN, Taylor.
Hi, good afternoon. So on January 17th, when a student walks through the door, how will it be different than before the break for them?
Yeah, great question, and it's a very broad question too. Circumstances vary so much within each school, so that's why I think the schools are asking for time to do those evaluations within their school. We've been here before, and we've asked schools and school divisions to step up and provide safe schools. And they're going to have to do those evaluations, whether they want to access a gymnasium, access a music room. to spread out their students. All of those things, all of those decisions will have to be made at the local level. Certainly from my perspective and from our government's perspective, we're going to ensure that the proper protocol in terms of safety equipment is there. We're going to work with public health to see what other protocols they feel should be in place. We will have those discussions again with our response group of our stakeholders to make sure that we are doing everything we can to support them in those tough decisions that they have to make.
Thanks. And I think all of you on this call are parents. So, as parents, how confident are you that your and other children are as safe as they possibly could be in the classroom?
Yeah, and I'm sure you're getting lots of opinions on this announcement today and where we're at and where we're headed. It's always been our goal to try to keep students in school. I mean, that has been key for us, but it has to be a safe area to do learning. And we try to find the balance. And Dr. Atwell talked about mental health and the importance of being in school. We certainly recognize that. I think parents, for the most part, recognize that. Teachers can teach better when they're face-to-face with students. That's ultimately what we're trying to accomplish. We're optimistic given this extra week. Schools and teachers and staff will have the ability to make these areas safe. And we're excited about trying to get these kids back into the classroom where they should be and be learning. And clearly, I know there's going to be parents that are going to want to keep their students out of school, and we respect that. The other thing we will urge is please consider vaccination. Vaccination will keep your students, your kids safe. It will keep them out of hospital for the most part. And just please consider that vaccination. Our numbers are going up on the vaccine side. This is our way out of this pandemic, and this is the way we can get our kids back into the classroom.
We now return to the news conference theater.
Shooter in your caucus.
So we made the decision, or certainly I made the decision based on Mr. Schuler's sort of a message that wasn't consistent with the spirit of our government's efforts to get Manitobans vaccinated. And so certainly, as a position in cabinet, we are the ones that form the public policy in cabinet, and so certainly we do expect that cabinet ministers would follow through with those commitments that we're making and the encouragement and the policies that we're putting in place with respect to getting Manitobans fully vaccinated.
So it was his comments at his news conference here in this room in mid-December where he talked about the vaccine messaging. That was sort of the straw for you?
Well, it's been many. I would say that it has been a distraction, I think, over the period of time where the refusal to sort of come out in public. I get that people's personal health information is personal to them, and I don't believe that I should be in the position to disclose what someone else's personal health information is. And that's why I left those questions up to Minister Schuler. And certainly, I think it just was going against the spirit of our policy of wanting to ensure and encourage as many Manitobans to get vaccinated as we could.
Is he going to continue to be in your caucus?
He is in our caucus, yes.
And will continue to be so? There's no vote on him coming up?
Not that I know of, no.
Okay. Dr. Atwell, I'm going to go back to my Code Red question. Given the requirements to move into Code Red, given the current strain on the healthcare system and the widespread community transmission, what is the factor that's keeping us out of Code Red right now?
Again, this is a rapidly evolving situation. I think, we're going to continue to look at where we're at and where we might end up being. And there's a lot of factors to play in here as well. And if things change, they will be announced.
What does the modeling tell us, though, Dr. Atwell? How many cases are we getting? What's our hospitalization looking down the road?
Right, so with the Omicron variant, we had some modeling related to that. I think it was shown that model is being fine-tuned at the present time, so we had some issues with the model, so we're hoping to get a new model in the next 24 hours. So I don't have a new model available right now. The only model we have is an older version, and basically you already have that information, or that information that was presented in the past.
Backlog looking like right now? Our testing backlog, what's that looking like right now?
So right now, our estimate is about 6,500 tests that are backlogged at the present time.
Minister, looking at this new back to school plan, is there anything that's actually changing? Because the province had already promised to send more masks, tests were already promised. So is anything actually changing today? Are schools going to be downgraded to code orange, code red? What is actually tangibly changing? Physical distancing is already happening in schools, so what is actually changing?
Yeah, I think we can learn from our past experience on this front for sure. And again, those individual decisions will have to be made at the school level in terms of how they best think they can keep students safe in schools. Clearly, we're going to be working with public health in terms of recommendations going forward. Things around protocols around contact tracing, what isolation requirements may look like, those sort of things. So this is going to be an ongoing discussion with school divisions and public health to make sure that we have safe facilities come January 17th.
We know that Omicron is highly transmissible, so is anything changing to lunchtime requirements? Students are all taking their masks off. We know obviously the mask requirements aren't changing. What is actually changing here for enhanced safety protocols in schools?
Yeah, we want to make sure that masks and personal protective equipment are there. We've committed to additional $5 million. We're going to put rapid tests available to communities that have outbreaks or high cases so that we can track certainly symptomatic cases there. We're going to continue to make investments and allow school divisions to make those individual recommendations as it pertains to those individual schools.
Is there any thought about mandating boosters for school staff or mandating vaccination across all staff?
No consideration of mandates. We're having in-school vaccination clinics. They're available to students and staff and community members. We're trying to make these vaccines available as much as possible. We're excited. The numbers are still going up in terms of the people getting vaccines, and especially now the youth are engaged too in the 5 to 11 population. So as we get more needles in arms, the safer the school settings become.
Other jurisdictions have stopped or decided to announce they're going to be no longer providing information about school cases. Is Manitoba committed to continuing to make those figures public?
Yeah, we fully intend to have our COVID website up and running to trace those schools with cases. Obviously, we're working on the contact tracing with our public health officials and school officials. So we're working through that, and we're working through the isolation requirements as well.
Dr. Atwell, back on testing, we have people waiting longer than a week. What is the wait time at this point, and when does that start improving?
So I do understand, like, a number of people have waited 5-6 days. Our backlog is about 6,500. We added in some increased PCR capacity just late last week. So we're hoping that will help out over the next few days' time. It already is helping out. I mean, our backlog was close to 10,000. So we are gaining some ground there with the rapid deployment of using rapid antigen tests in specific situations as well. That's alleviating some of the strain off the PCR side. But it will still continue to be strained, continue to be overwhelmed for the next several days for sure. And we'll have a better idea in relation to how much of a backlog there is in a few days' time, obviously, especially with another provider providing their services as well to help ramp that up. But do expect delays for the next few days for sure.
Premier, the news release alludes to rapid tests, and more of that's going to become available as well for the general public. When will that happen, and how will that be distributed?
Yeah, good question, Ian. And we're just waiting on further supply from the federal government. We'll continue to allocate those in the appropriate targeted places, obviously looking at more within our healthcare system, more within our testing sites, because we know that that has already reduced the backlog. I think it was 11,500 down to 6,500 today. We want to continue to move in that direction. So we'll continue to do that. And, obviously in schools as well, those are the areas where we want to target those. So again, it's looking at further supply, and we have put in a request for more supply from the federal government to ensure that we have the adequate access to those tests we're focusing.
Are there more restrictions coming? Can you confirm that?
Again, I think Dr. Atwell has spoken as well, and we're in ongoing discussions. This is an ever-evolving situation, and I think we're learning more and more about the Omicron variant every day that goes by. And there's certain preliminary, evidence that shows that it's maybe wider spreading, but not as severe. And so those are some of the things that, we'll look at. We'll continue to work with public health on those matters.
Premier, you
Last
talked
one
about
here, guys.
the
Last
consistency of messaging. And from what I can tell, Ron Schuler was consistent in his messaging from, the first time he was asked about his vaccination status and he refused. So, the consistency seems to be, there's a lack of consistency in what's expected of members of cabinet maybe. I'm just wondering, what changed? I mean, he has said he was not discussing it. 2 weeks ago in a year-end interview, he said, he's met the requirements, and, as long as he's following the rules, that's fine. Well, what rules changed, or how did the goalpost change? Was it just with Omicron, you needed to get the message out more forcefully that everyone needs to get vaccinated? Was that what was the determining factor? Because it almost seems like the goalposts were moved. Like he went and must have got vaccinated in order to be able to stay in cabinet, and then he's out. So I guess I'm wondering is what's the inconsistency?
So I think what you're asking about really is the timing of it, and certainly we've had a lot on the go, the 8 weeks or whatnot that I've been in this position, and so certainly we've had a lot on the go, and so that was what I felt was the appropriate time to take action. There are a number of contributing factors, and I've already outlined those, and so that's the reason for the timing, why it took place at that particular time.
Minister Cullen, there's 80 million that's been committed for new funding, but the news release alludes to some of that money going to wage agreements for teachers. To me, that doesn't sound like a pandemic measure. How much is going to settling teacher contracts?
Yeah, that's a great question. We've had some feedback from school divisions in terms of their pressures in regard to the new contract they've signed with teachers. So in each school division, this will vary. Whether they've had surpluses or whether they've actually budgeted for those increases. So it's pretty hard to respond because each case will vary with each school division. And I don't have a number for you today in terms of what percentage of that 80 million will be available for the actual COVID resources. We have developed a funding formula for that $80 million to get it out to schools. So we want to make sure that they have that information as soon as possible. Again, this is for pressures within the current year. I think it's fair to say that we recognize they have pressures going forward. School divisions are starting to budget for next school year. So their budget is July 1st. Normally we make an announcement in terms of school funding in around February 1st. We recognize the extra pressures they have this year as a result of the agreement. We're going to try to get a number to them prior to that so that they can go forward and do their work in terms of their respective budgets for next year as well.
Thanks, everyone.